1954, when the first successful kidney transplant between identical twins was performed, kidney transplantation has become the treatment of choice for end-stage renal disease, providing recipients with a significant survival advantage over dialysis. Nearly 30 years after that first transplant, the physicians and administrators at LDS Hospital were planning their own first kidney transplant.
We were finishing rounds one day. I was a general surgeon with a pioneering background for transplantation. And Dr. Alan Bloomer, one of the prominent nephrologists of that day, said, "Why don't we do kidney transplants here at LDS Hospital?" I said, "Well, no one has asked for it. Would you like to start?"
The stage had been set, the equipment and protocols were in place, and the need for a kidney transplant program in the Intermountain West was high. So, with the support of David Worthland, the administrator of LDS Hospital, and with the vision and direction of Dr. Alan Bloomer, the program was launched with a single momentous kidney transplant on December 8, 1983.
The advantage of being able to receive the care and the treatment without going out of state is wonderful. And the thing about this transplant program that Dr. Stevens established, it was very successful and very few complications, if any. And so it began as a high quality and very successful program.
Over the years, transplant physicians have continually sought innovative techniques to increase the number of organs available to their patients. Intermountain was among the first in the nation to recognize the feasibility of using subgroup A2 donor organs for transplanting patients of other blood types.
It was evolving even while we were a part of it to treat acute rejection episodes. There were specific treatments that were becoming available all the time, making it better and better.
Since that very first transplant, 2,166 kidney transplants have been performed. The Intermountain Transplant Center has grown into a well-respected transplant program that performs more than 70 kidney transplants every year, all while keeping waiting list times lower and patient and graft survival rates higher than the national average.
It's really a part of Intermountain Healthcare's mission, which was LDS Hospital's mission when they were the flagship hospital. And that is to provide the best possible care at the least possible cost and to be on the cutting edge of proven clinical protocols and to also pursue clinical research. And so those have been the missions for years, the mission for years and years. And that has only been expanded.
The Intermountain Transplant Center grew into a nationally recognized program at LDS Hospital before moving to Intermountain Medical Center in 2007.
It's really a team effort. You know, it takes transplant coordinators, it takes nurses, it takes physicians, anesthesiologists. You know, it takes a whole group of people to really make a transplant program run. And that's where we've been very lucky here in Salt Lake and at this program to have such a terrific group of people working on the team.
Our program was the first to initiate a Good Samaritan kidney donation program in Utah. And the advances in transplant medicine are helping more patients tolerate their transplant, avoid organ rejection, and maintain normal graft function without long-term health concerns, making the future of kidney transplant brighter than ever.
9 months ago, I went in to get a blood test and just a physical, and discovered that I had some abnormal things going on, and went to the doctor, and he basically told me I had kidney failure. So it was like a 2x4 up to the side of the head. It was pretty dramatic, and took me a little while to kind of grasp what was going on and just to accept what was happening in my life. I was laying there in the hospital bed, and my wife, you know, she's like, well, we need to get going and ask people for a kidney. And I'm like, I'm not going to ask people for a kidney. That's just, that's just not something I can do. But I was laying there in my hospital bed, and I thought to myself, you know what? I've just got to learn to accept people's help, and if somebody wants to give me a kidney, I'm going to accept it. And that's where my sister-in-law comes in.
Really happening.
Yeah, it's actually happening. So. What do you say about that? But 4 hours of surgery and 3 more hours of recovery, and I hope I don't remember anything. "9 days out, because it was a week ago this last Tuesday, June 4th. I don't know, Lisa, how you feeling?
I'm feeling pretty good. I'm discomfort, but not any pain, so to speak, unless I sneeze.
I'm actually feeling pretty good. Things have kind of turned, gone back to normal in terms of just the way I feel and bodily functions, and but I'm really sore still from the huge incision, and it's going to be a while before I'm kind of feeling 100%, I think, but just feeling much better, feeling really good overall.
The Intermountain Transplant Center's kidney transplant program is paving the way for future transplantation success, thanks to the efforts of a dedicated transplant team.
I think we've been fortunate to have a very able and excellent staff over the years. This has been a very stable program. We've had many talented transplant surgeons, and like I said before, a community of nephrologists that are very supportive, and it's an ever-growing program that we're all very happy with and proud of.
The lives saved and the endless lives touched and changed are the real future of kidney transplant.